Hi, my name is Judy Lim. This is my assessment video for Nursing 603. Hi, Mr. Castle. My name is Judy. I'm going to be doing your physical assessment today, okay?
Okay.
I'm going to start off by asking you a couple questions. Do you know your full name?
Yes.
And can I have your full name?
It's Richard Castle.
Okay. And do you know where you are?
Yes. The VA Long Beach.
And do you know what date it is today?
May 26, 2012.
And the general time?
2 o'clock.
So I can assess his short-term and long-term memory as well by asking, for short-term, I can ask, do you know what time your appointment was today?
2 o'clock.
Okay, very good. And for long-term, I can ask, do you know when the first Star Wars movie came out?
1977.
Excellent. For attention span, I can ask the client to spell the word large backwards.
It's E-G-R-A-L.
Very good. And throughout this conversation, I can see his speech pattern is normal and rhythm is normal, and thought process is logically, throughout coherent. His vital signs were taken earlier. His height is 5'5". He weighs about 185 pounds. His blood pressure was 118/76. Your heart rate was 80. Your temperature was 98.9. Your respirations were 16, and your pulse ox reading was 99%. And Mr. Castle, are you in any pain?
Not at the moment.
Okay, so we can infer that his vital signs are normal. I'm going to start off by looking at his skin. I can see that he has brown tone with pink undertones, and which is generally consistent for his ethnic background. I'm looking for cyanosis, pallor, jaundice, which he doesn't have, and I'm going to ask the patient, have you noticed any recent skin changes?
No.
And do you have any skin conditions that you know of?
No.
Okay. So the hair and nails portion of the assessment I can conduct during other parts of the exam to make sure it's more of a smooth transition, and I will continue assessing his skin. So the patient's overall appearance for personal hygiene and grooming, he's wearing appropriate clothes for age and weather, and his hair is very neat. I'm going to start with his head. It's normal cephalic. His hair distribution is distributed throughout his scalp. Hair color is brown. I'm going to palpate your head. Do you feel any pain when I do that?
No.
Okay. So his head doesn't have any deformities. I'm looking for masses, lesions, or scars, which I don't see. I'm going to be touching your face. Let me know if you have any pain, okay?
Okay.
So I'm palpating his frontal sinus, his maxillary. Do you feel any pain?
No.
Okay. So now I'm going to be palpating his lymph nodes. Okay. Occipital, postauricular, preauricular, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. And no lymph nodes are palpable. I'm going to now inspect the skin around the eyes, which is consistent with the rest of his skin tone. At this point, I can also look for facial symmetry by asking, can you please puff out your cheeks? And please move your eyebrows up and down, so his face is symmetrical. At this point, I can also look at his sclera and conjunctiva. Can you look up, please? Sclera is white and conjunctiva is pink, and look down. Very good. I'm going to have you look straight at me. I'm going to have a pen in your light, but try to look at me, okay?
Okay.
So corneal flexion is midpoint. Look straight at me. So pupils are round, equal, and reactive to light. Can you look at the wall behind me? And now look at this pen. Okay, and it's positive for accommodation. I'm going to have you follow this pen with your eyes only, okay?
Okay.
There's no extraocular movements or nystagmus. Okay, perfect. I'm going to have you cover your right eye with your right hand. Okay. I'm going to look straight at me, and I'm going to wiggle my fingers, and when you see my fingers, let me know when, okay?
Okay. Okay. Okay.
Good. just cotton swab with your eyelashes, okay? Sorry. I'm gonna touch this with your eyelashes.
Are we going to keep going or?
Yeah, we can do that. Let me
And
start
edit?
from here.
Okay.
Okay, corneal reflex. Okay. So now I'm going to assess for corneal reflex. Don't worry, I'm not going to touch your eye, okay? Okay, so that's intact. I'm going to have you also look at the chart to the left of you. Cover one eye with your right hand. Okay. And patient would be 20 feet away. And read the 7th line, please.
FELOPZD.
Very good. And with your left hand, can you cover your left eye? And read that same line backwards.
DZPOLEF.
Okay, very good. 20/20 vision. Can you use the pocket vision? 14 inches away from the face. Can you read line 6, please?
Okay. 374258. 3W3.
Okay, very good. So now I'm going to examine the external ear and look for any signs of inflammation or drainage. Does that hurt at all?
No.
Okay, and any tenderness on this side as well. Okay. Now I'm going to test for hearing acuity. I'm going to be pushing on one ear and I want you to tell me what I say, okay?
Okay. Blue.
No, this side.
13.
Very good. Okay. So now I'm going to perform the Weber and Rhines test. Okay, let me know. I'm going to hit this against my hand and put it in the middle of your head. Let me know if you hear it on one side better or the other, or if it's the same, okay?
Okay.
Is it the same?
Yes.
Okay, now I'm going to hit it again and put it against here. Let me know when you can hear it and when it stops. Now, and then I'm going to put it next to your ear and let me know when that sound stops, okay?
Okay. Okay.
And the same on this side.
Okay. Okay.
Very good. So air conduction is greater than bone conduction. Okay, now I'm going to look at the nose and look for symmetry, which it is. I'm going to have you hold one nostril and breathe in. Now the other side. Very good. Do you have any trouble breathing?
No.
Okay, very good. So his nostrils are patent. I'm going to look up. Nasal mucosa is moist and pink, and there seems to be no septal deformities. Okay, I want you to close your eyes and let me know what you smell, okay?
Alcohol.
Very good. So his smell is intact. Okay. Now I'm going to inspect the outside of his mouth. His lips are moist and pink without any lesions. Can you open your mouth, please? Okay. I'm going to check his teeth. There's no signs of decay. His cheek, hard palate, soft palate, uvula, and pharynx are all pink and moist without signs of ulcers or lesions or masses. Can you please say ah? Okay, when the patient says ah, his uvula and soft palate are midline. Can you open your mouth one more time? Okay, so his gag reflex is intact. Okay, can you stick out your tongue, please? So his tongue is midline. There's no signs of cracking or ulcers. Okay. So I'm going to touch your tongue with different tastes. Tell me what you taste, okay? Tongue.
Sweet.
Okay,
Sour.
very good. Okay, now what I want you to do is with your tongue, push against your cheek against my hand, okay?
Okay.
And this side. Okay, so tongue strength is intact. Okay, now I'm going to inspect his neck, and there's no visible glands or lymph nodes. trachea is midline, and assess his thyroid gland. Okay, can you please swallow? Okay, there's no nodules or masses felt. Did you feel any pain when I did that?
No.
Okay, very good. Okay, so now I'm going to assess your shoulder and neck muscles, okay? I'm going to have you shrug your shoulders against my hand.
Okay.
Okay. And now push your face against my hand, okay? On this side. Okay, so his accessory muscles are intact. Okay, now I'm going to assess his thorax and lungs. The skin is consistent, there's no skin conditions, and color is consistent. His AP to transverse diameter, the ratio is 1 to 2. I'm going to ask you to lean forward a little bit. His vertebral column is midline, there's no signs of scoliosis. Okay. When you feel my hand on your back, I want you to say the word 99, okay?
Okay. 99, 99, 99, 99.
Okay, there's no signs of feminist. Okay. I want you to take a deep breath. Okay. Lung expansion is symmetrical. There's no sign of lag. No cuts. There's resonance throughout. I'm going to take a listen to your lungs. When you feel my stethoscope, try to take a full breath, okay?
Okay.
I'm also going to take a listen. Right. Deep breath. And one more time. Okay, breath sounds are clear and there's no adventitious sounds. Now I'm going to assess for cardiovascular health. Okay, I feel no thrills. And the PMI is midclavicular in about the 5th intercostal space. I can feel a gentle, light tap. I'm going to take a listen to your heart, okay?
Okay.
I'm going to take a listen to the aortic, pulmonic, Erb's point, tricuspid, and mitral. Aortic again, pulmonic, Erb's point, tricuspid, and mitral. S1 and S2 heard no extra heart sounds or murmurs. I'm going to take a listen to your neck. And no carotid buoys heard.